I care. I care about you. I care about your mom or dad. And my goal is to let you go back to feeling like a daughter or son, not as a care manager.
What if the answers to agitation, to loneliness, and declining engagement wasn't more activities, but purpose? Today's guest believes every older adult deserves to wake up feeling needed. Through principles of Geriatric Montessori, she's helping families and providers rediscover what belonging really looks like in senior care.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights, and with our expertise, learn how to increase occupancy faster, guaranteed.
Hey, welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, founder of CCR Growth, the only demand generation agency that is exclusive to the senior living industry. And through this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations, strategies, and leadership insights that are shaping the future of the industry. So, whether you're a provider, a caregiver, or industry leader, this show is here to help you make informed decisions and create meaningful impact. All right. Today's guest is Marlena Hemenway, the co founder and chief brand ambassador of the Geneva Suites, a family owned network of boutique residential assisted living homes across the Twin Cities. Known for blending high acuity care with home like intimacy, Marlena and her husband Scott have built a model that bridges the gap between assisted living and nursing homes. She's also the host of the Care Truth podcast and a certified geriatric Montessori practitioner, teaching communities how to create purpose, dignity, and true belonging through individualized engagement. So I just said a lot. Welcome to the show, Marlena. We have a lot to cover. I'm so happy to have you here.
Thanks, Jerry. I'm happy to be here as well. I appreciate you inviting me to be a guest.
Thanks. This is going to be a great conversation. Yeah, I think starting with your journey would be helpful for our audience because I know, your journey into senior living didn't necessarily start with a business plan. It started more with a calling. How did the Geneva Suites come to life and what gap were you trying to fill between assisted living and nursing homes?
Yeah, so I actually started my career path as an educator. I went to school to be a special educator. I had been told I wouldn't be able to have kids, and then I had four, and I realized, wow, I have the patience for my own kids or a classroom of kids, not both. And when my now husband Scott and I got together, he had a home care company where we would go in and our staff would go and take care of people in their home. And we realized there was just a big gap in the market where people would move into an assisted living and they wouldn't get the care that they needed. They would push the button and have to wait for 30, 45, maybe even an hour to get seen. And then more falls were happening because they were tired of waiting. So we thought, maybe there's a better way that we could service the seniors. And we decided to look into the residential assisted living model and saw there were a few groups doing it successfully in the Twin Cities of Minnesota and decided, gosh, this sounds like what we want to do, but we want to do it a little better. So we did a few things that are unique. We have our own chef that makes all of our meals, which is pretty cool. So our staff aren't having to cook and clean up after meals. We have always had a therapist. So, whether it's an occupational therapist or a physical therapist, they work with our residents on strength, balance, life skills so that they feel as independent as possible. And then, after about a year or two of operating the Geneva Suites, I learned about the geriatric Montessori model. And I just fell in love with it and realized that this was how we wanted to engage our residents so that they can continue feeling like they have a purpose. So we're really excited about all of the different areas that we can shine. And we're kind of that sweet spot in between assisted living and a nursing home.
How did your education background come into play?
Well, I realize that there's not much difference between an IEP and a care plan. So I like
That's
to
true.
say I went to school to learn how to personalize things and really individualize someone's care. And it's been great because my brain is trained to look at, okay, here's this problem. How can we adjust a little bit one way or another so that this individual can be successful? Lots of problem solving.
Yeah. Yeah, I would imagine. From Leads to Leases is brought to you by Growthly, a smarter way for boutique senior living operators to grow. I've been in marketing for almost 3 decades, and through my agency, I've helped some of the largest senior living providers attract qualified leads and fill rooms faster while lowering their acquisition costs. But one thing kept bothering me. While working with larger communities, I kept meeting smaller operators, 10 to 50 bed communities that were struggling to compete with the big box providers because they don't have the same budget, staffing, or support behind them. And as a small business owner myself, I get that. You're wearing 5 different hats, you're trying to fill rooms while still giving great care, and that's exactly why we built Growthly. Growthly takes everything we've learned from helping large operators fill their buildings and makes it accessible to smaller communities without retainers, without long-term contracts or inflated costs. It's a performance-based partnership, and you only pay when we deliver move-ins. We help you stand out online, stop depending on referral agencies, bring in qualified families, and fill your community faster. Growthly is built for your small community and designed for big results. Learn more at growthlyseniorliving.com. One of the cool things too, you mentioned a little bit, and last time we spoke as well, was why belonging sells better than amenities. And there was actually an AARP fact that said 76% of adult children say trust and staff warmth outweigh amenities when choosing senior housing.
I think that's true if they've been to a place that didn't work and
Yeah,
then they go to some
that's
place
true.
that does. I think the first go, people look at the amenities and think that, oh my gosh, this is great. There's a movie theater and there's a, look at this. There's a spa, there's a pool. And, when you really break it down and think about it, what does mom or dad really want? What are they really going to use? I think that helps a ton.
What do you think operators can do to shift the marketing? It's still, I mean, it frustrates me to no end to see them talk about amenities and features over everything else that's actually happening at the community. I mean, getting them to talk more about or resonating on an emotional level. What do you think operators can do to bring more of that to the forefront?
I created something called a Care Vision Tracker. It's a one sheet that I fill out with families that talk about, what are the care needs of the individual? What are the priorities in picking care? And what are some of the barriers to care? If they had a chance to wave a magic wand and create a perfect environment for their mom or dad, what would that look like? And then a small section on that one sheet that talks about finances so families can determine if they're being realistic about what they want or not. The idea is that they can take this sheet and go to any facility and say, these are our goals. This is what we're really looking for. Is this something you can provide? And I think to your point that people need to start looking more emotionally versus the actual amenities that are out there. I think that's going to happen when more families start talking before they're in an imminent need, before they're
This
in a
is yeah,
crisis. I
yeah.
think that people get very reactionary and they're like, ooh, this is a pretty shiny box and this works for me. And so this will work for mom. And they haven't actually had the conversation with their mom to determine what really is going to fit and what's really going to be a good long-term solution. I think when we can break down some of those barriers in the beginning and have those conversations way sooner than what someone actually needs it so people can have a plan, can do a little looking ahead of time, I think that's when we'll start seeing more of that change.
What do you think are the first words that a family? I mean, unfortunately, they are often reaching out in crisis, but what do you think are the first words they need to hear?
I care. I care about you. I care about mom or dad. And my goal is to let you go back to feeling like a daughter or son, not as a care manager. And I think showing them how you can support them in the care for their loved one, in the care for them, so that they can have that relationship again before their parents are no longer around, I think is huge. And that's something that our families really resonate with, is that we take over a lot of that so that they don't have to deal with med management. They don't have to deal with developing a care plan. Obviously, they're still there and visiting their mom or dad, and we're open to their suggestions because they probably know them in a way that we don't. But I think helping them understand that the care is really what matters. Obviously, we want the food to be good, we want the building to be pretty, we want all of those things, but how they're getting cared for is really what's ultimately going to make the difference. I go back to that Maya Angelou quote, right? It's not what someone says, but it's how they make you feel. And I try to really focus in on that. And if you feel warm and cared for and appreciated, then that's going to reflect in how you feel day to day.
Yeah. Yeah, and you've got so it's such a multi-layered challenge too because you've got not only the older adults fear, their fear of losing control, fear of losing access to certain things, then you got the family's fear, same fear of losing control of the situation, right? Now mom or dad's in someone else's hands, but also
Hmm.
like, fear of, they have guilt, they have denial, like there's such a bag of emotions that are happening all at once. It's kind of a
Yeah,
lot.
I had a reality check the other day. I was talking to a family and they're like, I never wanted to have to do this. And it really hit me and I'm like, you know what? I'm selling a product that no one really wants. Right? No one wants to get to the point that they have to move their mom or dad into a facility. No one wants to not be able to live in their home anymore. However, sometimes, what is that song? You don't always get what you want, right? Sometimes it's really hard because even though it's not what you want, it's what you need. And helping understand that you're still caring for your loved one by putting them in a facility that can really support them where they're at, better than letting them stay where they currently are and then fail. And now you're dealing with a crisis, if that makes sense.
Yeah, no, that makes total sense. One of my previous guests when we had a long conversation about the fact that 90% of the available market will never even consider moving into a community, even a small residential assisted living home. It's the complete opposite of what people want for their loved ones on some level, but they're also doing them a disservice in the process because I look at my own family, my mom felt guilty because my grandmother passed away and she didn't want my grandfather living by himself, so she took him in. And when she took him in, it was kind of chaos unfolded on the home within 6 months. I mean, he had gone from being pretty social and active to literally sitting in a chair watching TV all day. So how was that any better for him than him, finding a community and a group of peers that he could spend his time with? So they quickly realized that that was a mistake. But I think a lot of families they struggle with those challenges and making those decisions.
Absolutely. And I think it's really hard to, you know, what the children of the loved one who needs care thinks or wants may be very different than what that person actually thinks or wants. And so having those conversations early and really drilling down into, what do you really want, mom? Some families think, oh, we should be in a place where there's tons of activities. That's going to make my mom super happy. And when you talk to mom, she's like, I'm more in a place in my life where I'd rather have quiet and I want time to reflect and think about my past and look at old pictures and reminisce. And so I think some of those areas get missed. And so having the conversation earlier rather than later, I think is really good. I think it's also really important to think about, where has your mom or dad lived for the last 20, 30, 40 years? Did they live in a tight knit community where they were around people all the time and very active in their church and
Hmm.
in their community? Then a big setting may be a really good fit for them. They're going to feel that community and really get it. But if they're lived in a house and kind of just did their own thing and maybe went to church on Sundays, but it wasn't a big community feel, putting them in a large building where they're one of, 75 to 100 plus beds, they're going to feel overwhelmed and not feel like they can go out and chart that territory. I think that's why having so many different options is key, and having the conversation early again is really really important.
Talk to me about the Montessori model too, because the obviously specifically the geriatric Montessori model, but I mean I've heard Montessori for decades, and from everything from early childhood education all the way now to geriatric care. It's a term that gets tossed around a lot, and people usually get excited when they hear that it's something that's being offered, but I don't think many people know or truly understand what it entails. So maybe you could give our audience a little bit more information.
Yeah, absolutely. So, for geriatric Montessori, how we really have embraced it in our communities is having the residents have a purpose. You and I wake up every day with a purpose, right? You want to help people fill their assisted living homes. I want to provide care for residents and their families and my staff. And so every morning I wake up with a purpose, with things to do, and that motivates me to get up and get going and doing things. And I don't think that need to have a purpose ends when you retire or when you have an ailment that you aren't able to care for yourself anymore. You still want to feel like there's a reason you're here. You have a job or a goal that you're going to do every day. And that's what I think geriatric Montessori really highlights the most. And it creates autonomy. It has little stations that residents can go up and participate in without having someone have to get supplies out or have to help them do whatever the activity is. And so I think those two things together make it very, very powerful. I see, we've had residents who, sometimes with dementia, it takes away mobility. Sometimes it doesn't. And I've had a few residents that maybe aren't able to talk anymore. They're not able to make good decisions, but they're still very able to ambulate and get into trouble really, really quickly. And so, emptying drawers, stripping off beds, getting into garbage. I mean, all those kinds of things. And I had one gentleman in particular who was very, very able to ambulate, and just would like to pick, like he just liked to get into things. And so what I ended up doing was getting him a Swiffer that he could use whenever he wanted. We put his name on it, and he would walk around for hours moving dirt from point A to point B. Granted, did my staff have to go around and pick up the little piles? Sure, they did, but they should be doing that anyways, right? And he stayed busy, and he was so happy. I'd come in, I'd be like, Bob, my floors look amazing. And he would just beam, he would just smile. And his daughter's like, I haven't seen him smile like that in years. It's because he felt like he had a purpose, right?
Mhm.
And he ate better because he was moving his body. He slept better because he wasn't dozing all the time in a chair. He got into way less trouble, and he was proud of himself. And he used his Swiffer until about 4 or 5 days before he passed away. And his life was happy. The end of his journey was full, and that's what we're looking for. And it can be as simple as that. It could be, so many ladies, in the generation of being primary housewives, right? So they love wiping down counters. They love folding laundry. It's what they know and what they do. They don't even have to think about it. They can do it and be successful. And so setting them up to succeed in those areas are great. And then they feel good about what they've done, and they can rest easy.
I thought it was really interesting too. There was a study done by the Journal of Aging Studies all around Montessori based engagement, and they said that it reduced agitation in dementia residents by up to 40%. And like you're saying, improves mood and cooperation. So it seems, I'm surprised that there aren't more communities that are implementing this type of program.
Yeah, I think communities think this is going to be super expensive and really hard to implement. And what we found in our community is it's the exact opposite. We want to use materials that are materials we naturally have in a home. And because that's what people want, right? Like I had one gentleman who had an automotive company. He fixed cars forever. And so I'd get a bucket of screws, bolts, and nuts, and I'd jumble them all together. I'd be like, Joe, I did it again. I messed all these up. Can you help me organize these? And he's like, man, your husband must be so mad at you. You're always messing these up. I'm like, I know. And I'm so glad I have you to help me get it all together. And so he'd spend hours unscrewing the nuts and bolts and putting them in a 4-piece compartment. That kit that we used for months cost me like $10, right? It was so simple. And he felt good about it. I felt good that I know if I sat him down at the table with this, he was going to be happy for a while until one of his other basic needs needed to be met. And then oftentimes he'd be like, I got to go back to my job. I got to go back to work. And they want that. I mean, we spend how much of our lives working, right? To have that
Yeah,
totally taken
it's
away and
true.
not feel like I have anything to do, you feel lost. Vacation is great until about day 5, 6, right? And then all of a sudden it's like, okay, I gotta have something else to do. I gotta do something. I'm a big fan of Teepa Snow, and she's like, going on a cruise is a lot of fun, but you don't want to live on a cruise, right? You want to have things to do. And so that's where I see the geriatric Montessori making a big impact.
If a community wanted to implement a program like this, how would they get started?
There are a lot of different ways. The mentor that I studied under, her name is Jennifer Bush, and she has a program called From Can't Do to Can Do, and she's fabulous. And I went through her seminars and her year-long training, and that's what worked for me. I mean, there's tons of resources out there. If you Google geriatric Montessori, you can probably come up with a huge amount. There's also a great website called goldencarers.org, I think it is, or .com. They have a ridiculous amount of activities on there, and they can easily be modified for it's goldencarers.com. And they have a great amount of information that you can use to start things off so you're not having to recreate the wheel. We all have a lot going on. I think we're a generation that just has so much heaped on our plates. We need to work smarter, not harder. And those are some great resources.
And is that something the entire team would need to be trained on, or is it something where maybe just upper management gets trained on it? How does that work?
No, I think your whole team needs to understand why it's important. Um, we put it in our orientation. Upper management understands it, but they're not the ones doing it, right? It's the staff that are in working with the residents that need to be a part of it. When my staff really started understanding that this is going to save them time and make their day easier and better, then they jumped on board. And I'm happy to be a resource as well. I do a lot of public speaking about geriatric Montessori and how it benefits seniors and why it's so important. And I'm happy to come out and talk to communities about that too.
Is there anything different that a larger community, maybe not a residential assisted living home, but a larger, say 50, 100 bed community would have to do differently to support a Montessori style engagement?
Think so. I think it's just uh, understanding your residents and what makes them feel important. We have an assessment that all of our new residents take that help us understand what they enjoy and what works for them. And then we figure out how do we set them up to succeed to do that in our community. And I think it would be the same thing in a large building, right? In a large building, they tend to have an activity coordinator, or life enrichment coordinator. They have a nurse that's following and creating a care plan, and you build it in. It's part of their day, and staff can support that. And then as they do it more and more in your setting, then it gets to be something that they can do on their own. In large buildings, I know around here, a lot of large communities have, they almost look like little alcoves or little niches in hallways and such. And it's like, well, what do you do with this space? And those are great
Hmm.
spaces to put stations that someone can wander up to and participate in for as little or as long as they want and then move on. We have flower arranging. You can have a bunch of silk flowers that people can arrange, and then those can be the centerpieces on tables. That's a great, easy Montessori activity. You can have, I mean, who doesn't have a ton of Tupperware at home with lids that don't match? Bring them, they can match them all, nest them so that they are in one container. That's a great Montessori activity that, if a lid gets lost or broken, okay, it's not the end of the world. Those kinds of things are super helpful. Look at your community and what things are hard for your staff to find time to do, and how can you make that a job that would give someone a purpose. And that's something that, a lot of seniors would enjoy doing. Maybe it's someone who's always been a social butterfly, and she welcomes other residents into the dining hall and makes sure they know where to sit and just talk to everyone when they aren't getting much interaction because they're spending so much time in their apartments. What a great job for someone to have. And they can do that sitting in their chair, standing at their walker. Any of those would allow them to be successful in that. So it's just putting that creative hat on and saying, who do we have that we can help bring our community more joy?
I love that. I love that. Those are great insights. Shifting a little bit to talking about the future of residential assisted living. I feel like this is the future of this entire industry, because I think the big box operators see that model is not necessarily going to work specifically for, I think, the baby boomers. I think they're a little more particular
Yep.
in what they want.
Well, the
Uh,
boomers have changed everything, right? They changed how people looked at toddlers, how they looked at elementary school, how what it means to be a teenager, what rock and roll is. I mean, they've changed everything. So it doesn't surprise me that they're going to change how people look at assisted livings. I think very few people want to bounce around to lots of different locations. And I think in the residential model, they are able to provide higher levels of care. I think the biggest struggle is going to be, how do those facilities get compensated? Because right now, you know, the waiver programs are such a small amount in comparison to what a private pay individual would pay for. Small operators can't afford to have everyone be on a waiver and provide the services that are needed, at least the way the payment structure is now. So I think that's going to be a really big struggle. But, you know, the government doesn't seem to have a problem paying for nursing homes, and nursing homes are way more expensive than assisted living. So someone's got to put their thinking cap on and figure out a way to help support all of these individuals that built the great country we live in, and help them have success in ending their journey. It's just not as popular as the kids, right? We all want
yeah.
to support the kids, which is great. And I do too. I love my kids. I love kids in general, but the kids haven't contributed anything yet. The seniors have. And I think we need to start looking at that a little bit more.
Yeah, I think it's challenging. I mean, how do you scale intimacy? That's the biggest challenge. I think for me, if I was at the age where I was looking, or my family was looking for me, I know that I would want to be in a smaller setting, a smaller intimate setting, and to have that peace of mind to know that like I can stay here for a longer period of time. I think that's one of the biggest fears that families have is, okay, this is good for mom or dad right now, but what happens in 3 years when they have higher acuity than they have right now? Are they going to be able to stay? Are they going to have to move? are we going to have to bring in outside help? Like, what do those costs look like? So I think this is just such a better way to go about it.
Yeah, I
Um,
do too. I mean, my dad has very fragile health, and my plan eventually, when my mom says, I just can't do this anymore, is to move him into one of our homes. Right now, my husband's mom is living in one of our homes because we truly do believe this is the best way to get the best care.
because it's not necessarily a federally regulated option for housing. I mean, how does that work? Because you're in a specific area. I mean, I'm sure there's different regulations in the Twin Cities than there are, say, in where I live in on the central coast of California. How do you balance those regulations with growth and on like preserving what makes your communities personal?
Yeah, so I mean the state of Minnesota is very regulated. I think we're regulated about the same as California, which is in my opinion a little too much, but we won't get on
Yeah.
that
Yeah.
soapbox today. Um I think we need to start remembering that we are humans taking care of humans, and it's never going to be perfect. And, you know, if people want perfection, then they should take care of their mom or dad at home and they do it their perfect way. That's my opinion. I do believe that if we started having regulations for the masses, the majority of the people, there can be a few one-offs here or there, but making rules and regulations for the 0.01% that this is going to happen, I think is putting such an unnecessary burden on the system that it's really hard for anyone to succeed. But that being said, I do think having the smaller setting is going to be better. I think, we all do have state regulations. Right now, nursing homes are federally mandated. I
Hmm.
have a feeling something similar is going to happen with assisted livings just because there's such a huge gap in between some states that have basically nothing and then some states that have like this over regulation. I think it would be really interesting to do a study to see, on average, does a person live longer in the state with all these regulations or the state without them? Like, is there much of a difference in the incidents that happen? Is it happening the same amount or different in the different um, in the different settings? I would hypothesize that the states with more regulations have more incidences because people are so occupied with filling out paperwork and checking all these boxes that they're not able to provide the care like they would if their job was just to care for someone, if that makes sense. No one goes to work as a care provider and is like, you know what? Today I'm going to neglect someone today. That's my
Yeah.
goal,
It's
right?
on my
No one
list.
says that. Right, it's on my list. But, when you have to spend 15 minutes documenting something versus taking care of someone, then someone does get neglected because there's only so much time in a day. There's only so much two hands can do at one time. And that saying, if you didn't document it, it didn't happen, is so
Hmm.
real. And the way the states come down so hard if things aren't exactly the way they want it, it takes a lot of time. And I don't know that the state legislators have given that part of it um, the importance that it's not necessarily helping the situation. I don't know. That's just my opinion.
Yeah. No, I saw a crazy data point that says something like with caretakers, they spend close to 50% of their time documenting, taking notes, not necessarily spending time interacting with their actual residents. I thought that was pretty interesting.
That
What?
doesn't surprise me at all.
Yeah. What about affordability? Because I I mean, housing is such a major issue in this industry just because we have probably one third of the housing that we actually need for based on the projections of the number of seniors who are going to be looking for housing in the next, say, decade or 2 decades between now and 2040. Um, and then you look at residential assisted living, it's primarily private pay. How do we figure out that crisis? Do you have any thoughts about that?
It's a tough one. I think it's a mindset, right? People have worked their whole life to build up assets, and they don't want their assets to go to care. However, they want really good care, and you get what you pay for. So, I think that we need to start saying, I worked hard so that way at the end, when I really needed someone to be able to take care of me when I can't take care of myself, that I put in the work so that's available to me. I do think that it's unfortunate that we haven't figured out a way for the government to help subsidize some. I don't think it should have to be an all or nothing. I think it would be great if, almost like schools where you can pick a charter school and you get a credit. And if that credit doesn't totally pay for it because you want the Ritz-Carlton version of assisted living versus the Holiday Inn, then you you can supplement it. But the way it is now, it's like you have to run down all of your money to basically nothing before things come in, and that doesn't feel fair either. But everyone needs a living wage, including the staff that are taking care of people, and it's not a glorious job all the time, right? Helping someone with incontinence, helping someone with behaviors, like that's a tough job. And if we don't want them to burn out and say, you know what, I'm not doing this job anymore, then we have to give them some financial compensation that's fair. And so it really is a balance, but it is a mindset as well. And I do think that if we can create a little bit of support, I don't think it needs to be everything. I don't think the government needs to pay for all of it, but I do think helping compensate the facilities, I think, especially if they're meeting certain criteria like, med management without errors, or, I think they could create some realistic criteria that if you're meeting these, you're an A facility and families can get this kind of credit. And then as a facility, you can say that credit's enough for this resident, or I need the families to pitch in an additional whatever. That's up to the facility. I don't think it gets talked about enough. Most people like to say, oh, they're old, you're just going to stick them in the nursing home and that's where they go. And I think the boomers are going to push that hard enough that that's not going to be the easy answer anymore.
I would agree with that. And I think people are short-sighted too because the wave hasn't even hit yet. And people are acting like it's already here. The entire baby boomer generation will be 65 by what, 2029, something like that. So,
Something like
you
that.
know, we're not really going to see that boom happen until, somewhere between 2030 and 2040.
I think we're also going to have to rely on some AI as well. I think there's a lot of areas where AI can help with predicting where staff should be going and helping with putting some things in place so that it's a little more automatic. If body cams, I don't know if it's that necessary, but if you had an AI little bot on your clothing and it documented for you while you're doing the care versus you having to take time and do it, that would alleviate a ton of documentation time, therefore giving more time to the residents. And, maybe instead of having so much where it's credits to the residents, if the government doesn't want to help with that, maybe it's helping give these kinds of support or programs so staff have an easier time and, you know, it's less of a financial burden on the facilities so that cost doesn't get sent over to the residents. Yeah, there's lots of different ways to do it.
Yeah. Yeah, I mean, staff burnout and compensation are gonna be huge. I mean, I think between now and 2040, the long-term care worker workforce is supposed to I think we need an additional 11 times the number that are currently working in the space right now. So there has to be compensation there, obviously, and there also has to be some level of job satisfaction.
Yeah, and I think, that's where the smaller model can be really helpful too. We see a lot less burnout because they're not trying to run after 20 to 30 residents. they're in charge of 6 residents and there's 2 staff members there. So really it's a 1 to 3. So it feels a lot more doable than when they're responsible for all these people and they feel like they don't get to do the part of the job that they originally wanted to do, which was take care of people, spend
Absolutely.
time, build those relationships.
Marlena, is there any upcoming initiatives or anything that you're working on right now that you want our audience to know about?
Well, our mission is to enhance lives, and in Minnesota, right near the airport, there's this huge oak tree that actually sits on one of our properties, and the previous owner of the home used to light up the oak tree at Christmas time, and we decided this year to do that as well. So the tree, I can send you a picture of it. It turned out spectacular. It has a little over 40,000 lights on this oak tree. So
Whoa.
when you fly into Minneapolis, you can see the tree from the plane. It's amazing. And so we actually put together, it's called Free Funder, and the um, campaign is called Shine on Bloomington. And, if anyone wants to check out the tree, come to Minneapolis. We'd love to see you. But anyone who wants to help spread a little joy, we appreciate those contributions.
Awesome. Yeah, I'll definitely include that in the show notes so people can check out a photo as well as donate. And that's going to be running until when?
January 31st.
Okay, cool. All right. So
Yeah,
our
so it'll
audience
be
has
on
some time.
for a little while. We figure, boy, society has been dark lately. There's been so many tragedies and so many things that are just hard. And so we thought, wow, if we could bring a little light, joy, and hope, what a cool thing to be able to do.
Yeah. A lot of light. That's 40,000 lights. That's a lot of
Right?
light.
It is a lot of
That's
light.
awesome.
And it's yeah, we've had quite a few of the news channels have come by and done stories on it, and the overall community is just thrilled because we weren't able to light it for about a decade. So the family before had it lit for I think 2 decades, and then it's been dark for about 10, and then we're lighting it again this year. So we officially turned it on just December 7th. So
Awesome.
really
Awesome.
fun.
Well, Marlena, thank you so much for such a great interview, sharing all this knowledge about the geriatric Montessori model with our audience and the value of residential assisted living homes. I think it's the future of senior living. Where can our audience go to learn more about the Geneva Suites or connect with you directly?
Absolutely. Our website is thegenevasuites.com, and you can reach me directly at Marlena at thegenevasuites.com.
Did you want to mention the podcast at all?
Can absolutely, yeah. So the podcast is The Care Truth, and we're on YouTube and Spotify.
Awesome. Okay, great. Well, we'll make sure we include all of that in the show notes as well. So, as we wrap up today's episode, I want to thank you, Marlena Hemenway, for joining us and sharing how purpose, belonging, and dignity are redefining care in senior living. From geriatric Montessori practices to honest family communication, Marlena reminds us that when older adults feel needed, everything changes from engagement to outcomes. So, if you want to learn more about the Geneva Suites or listen to Marlena's Care Truth podcast or check out this amazing tree, you'll find and donate to the cause. You'll find all of these links in the show notes. As always, we hope you found this episode insightful and inspiring. And don't forget to subscribe to From Leads to Leases on your favorite platform and stay tuned for more conversations that shape the future of senior living. I'm Jerry Vinci, founder of CCR Growth. Thank you for joining us. And until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Marlena.
Thanks, Jerry.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.